Thank you very much, Bill. As Senator Cassidy mentioned, this piece of legislation has been a long time in the making. We weren't sworn in for more than a handful of days before we started talking about collaborating on this piece of legislation and working with some of our great House colleagues who have introduced a companion piece of legislation. Congressman Tim Murphy, A.D. Bernice Johnson, Paul Tonko, amongst others, have introduced a piece of legislation that, though is not identical to this bill, I think they can safely be called companion pieces of legislation. There are 44 million Americans today that are suffering from mental illness, and there are 13 million people who have a serious debilitating mental illness. And yet, over the last 10 years, we have closed down 14% of our inpatient psychiatric beds. 1 in 5 adolescents today are dealing with a mental illness diagnosis, and many of them are starting to show those initial signs of serious mental illness. And yet, we only have 8,500 child psychiatrists in the entire nation. A number of years ago, we promised parity in our insurance system, that if you had an insurance benefit, you'd get covered for mental illness just like you did for primary care services. And yet that vision has not been realized, such that discrimination continues to happen in insurance plans. And the latest report says that our economy is losing $190 billion every year in lost productivity due to people who can't work because of serious mental illness. And then on the margins of mental illness, there is this increasing occurrence of violence. Now, I want to be clear, people with mental illness are much more likely to be the victims of violence than they are the perpetrators of violence, but there's no way to avoid the fact that every day we seem to be waking up with a new incidence of mass violence, and we can't help but believe that fixing the mental health system will reduce the likelihood of these episodes continuing to occur. This is a very personal issue for both Bill and I. And frankly, Senator Cassidy and I disagree on a lot. This is a conservative Republican and a progressive Democrat. And we frankly disagree on some aspects of the response to mass violence. But we agree that it's time to promote a comprehensive reform to our nation's mental health laws. First, because it's just the right thing to do. And second, because it is part of a response to the increasing levels of shootings across the country. And we also think that it's past time for Band-Aid small-scale fixes. And this is the first bipartisan comprehensive mental health reform to be introduced in the Senate, certainly in the time that I've been in Congress, and I'm proud about that. And again, I'll say that I'm proud to be working with our colleagues in the House. We think that these two bills together represent the best chance of getting behavioral health reform legislation passed in this Congress. Senator Cassidy talked a little bit about what this bill does, but it is about building capacity, both inpatient capacity and outpatient capacity, making sure that there are more inpatient beds for the seriously mentally ill, making sure that there are more providers available to do outpatient work. It's about investing in innovation, making sure that we are doing research on and then disseminating best practices for the care of those with mental illness. It's about coordinating two systems that often don't talk to each other, a behavioral health system over here and a primary care system over here. That's not about resources. That's just about making the two systems talk together. And it's about elevating the conversation here in Washington, making sure that behavioral health has a seat at the table at HHS in a way that we just fundamentally don't believe it does today. And then it's about addressing these inadequacies in some of our existing laws, like privacy laws and HIPAA laws, to make sure that, especially for the seriously mentally ill, that their caregivers, their parents, have the ability to have a say in their treatment and keep them on track towards recovery. We're introducing this bill today, but we've been in fairly constant conversations with our colleagues, and we expect that we're going to have a broad array of support from Democrats and Republicans in the Senate over the course of the rest of the summer and fall. And we're looking forward, as members of the Health, Education, and Labor Committee, to bringing this to the committee very soon. I'll just sort of end with one quick final story. Avielle Richmond was one of the little girls that was killed in Sandy Hook. This is a curly-headed little girl who loved horses and Harry Potter and the color red. She told her parents that her dream in life was to own a minivan someday. And her parents, not unlike many of the other parents from Sandy Hook, did something really exceptional. Afterwards, they set up a foundation, and their foundation is designed to do research, to better understand where mental illness intersects with episodes of violence. And yet they're a supporter of this effort today, even without that research taking place, because they know the mental health system needs to be fixed for everyone in the system. But the families in Sandy Hook, they want changes to our nation's gun laws. But they don't want our disagreements over those issues to stop us from making bipartisan progress on other issues that are important to them, like our broken mental health system. And that's the message that they clearly conveyed to me. And I think that's the message that members of Congress are hearing all across the country. We can have our disagreements on other issues, but there's more agreement around fixing our mental health system than you may think.